And I think that's a really, really important question. When I think about peer engagement, that's one of the biggest areas of challenges for a lot of our kids. And we've talked to educators about, hey, so-and-so loves chess. Is there a chess club that we can kind of start to facilitate? You're probably right where you're supposed to be, and it's probably part of your journey.
Welcome back to another episode of the Unspoken Words podcast, a Selective Mutism podcast by the Smart Center, produced and published by New Edition Productions. This episode features Dr. Elisa Shipon-Blum and Dr. Jenna Blum, director and lead clinical psychologist at the Smart Center's growing counseling and assessments department, answering some of the most frequently submitted listener questions they receive at the Smart Center. They tackle why children with SM can speak freely at home yet shut down completely around peers, why initiation is so much harder than responding for children and teens, and how parents and school professionals can stop waiting and start facilitating the connections that make real progress possible. Dr. Ree and Dr. Jenna also dive into a really interesting topic on this episode, and one we haven't really touched on yet in this podcast: grief. Whether you're an adult reflecting on a childhood without proper SM treatment or a parent still waiting to see that progress you'd hoped for, this episode speaks directly to that experience and offers a genuine path forward. It's another great episode. Really excited for you guys to listen to it. If you have any questions on anything you hear while listening, just head to selectivemutismcenter.org/ask Dr. E. That's ASKDRE. Enter your question in the form. And make sure you're also following the podcast on Instagram and YouTube. We are at Unspoken Words _podcast on Instagram and Unspoken Words podcast by Dr. E on YouTube. All right, enjoy the episode.
Before we get started with the episode, if you have a child or teen with social communication challenges, listen up. For more than 20 years, the Smart Center has helped over 6,000 individuals overcome selective mutism. Now we're bringing our expertise to you in a new way. With our 6-week virtual social skills series, over 6 sessions, your child or teen will learn through activities, role plays, and real-life practice by learning conversation starters, developing friendships, and managing social anxiety in a safe and supportive space. Our trained clinicians meet every child and teen where they are, whether nonverbal, finding their voice, or already verbal. We run new groups every few months. Visit the link in this episode's show notes to register your child or teen today. All right, enjoy the episode.
Hello, listeners. Welcome to another episode of Unspoken Words. Very often we do these Ask Dr. E's and now Ask Dr. Jenna's on various questions or topics that come into the Smart Center. Sometimes it's families that we're working directly with. Sometimes it's families or individuals that are new to the center or just send us a question. But we've gotten a topic recently, and I've heard about this very often, obviously throughout my entire career, as have you, Dr. Jenna. And it's on the topic of grief. And Dr. Jenna, you're here. And, you're going to talk about it. And it's something we hear a lot about. And our listeners are going, grief? Hello, Dr. Jenna.
Hi.
Let's start out with a question that we get a lot. It's funny. We got like 3 questions, almost exactly the same, from a family or families recently, and even from school professionals. But one of the questions that came in, I'm actually going to read it because, like I said, there's been 3 recently, almost absolutely identical questions. My child talks comfortably at home, becomes completely silent around peers. Why does this happen? And then number 2, we got, how can I help my child start interacting or speaking with peers without making them feel pressured or overwhelmed? And then another one that came in, my child seems interested in other kids, but doesn't join in or respond when spoken to. How can I help them initiate or engage socially? Mm-hmm. So what do you think about when you hear those questions?
Yeah, I think that there's many different factors into why maybe some of these obstacles are occurring for a child. So the first question that we always say is, we'd want to learn more about kind of those underlying contributing factors into the maintenance of your child's selective mutism. But what I would say too is when I think about peer engagement, that's one of the biggest areas of challenges for a lot of our kids. And again, for a variety of reasons, but I would say that facilitation is so important, right? And kind of that's why educating your school's teachers, educating family relatives, various people that are going to be engaging with your child is important, because many times when we think about social communication, there's two parts of communication, right? There's the responding piece and the initiating piece to have a back and forth conversation. And we find that pretty much like 95% of the time, of course, there's always going to be tweaks, but most of the time, it's 95% of the time, individuals have a harder time with initiating. So they might respond they might maybe engage if a peer's like, oh, come play with me, or if, a teacher kind of facilitates something, but they might not necessarily go out of their way to initiate a play or to initiate, an engagement with someone. So I do think that some of these challenges that we get, a lot of these frequent questions probably stem from the fact that maybe there isn't a lot of facilitation going on. And so our child is maybe sitting there wanting to engage, right? Many times we get this feedback, whether it's from the actual kids themselves or from parents, where after school they'll say, like, I wanted to move, but they felt stuck, right? Like it's almost like you feel like you're literally, few of our teens have mentioned like this idea around like a paralysis, like they feel paralyzed to move. So they want to engage, but it's more like how. So I think like there's again so many ways that we can break down those three questions, but I wanted to kind of emphasize that piece, that I think the initiation piece, because it's so much harder, is how can we maybe help our kids, teens, or even young adults or adults, how can we help them navigate that so that they can have more of these successful engagements?
And I think it's so important that some of these key concepts that we talk about a lot, comfort precedes communication, social engagement precedes communication. And so often we are wanting, and it's very obvious to many kids and teens that we work with, that my mom and dad really, really want me to talk. They really want me to. And I often feel bad what some of the older individuals share with us because I can't. And when you really dive deep down into this, I say to myself, is there opportunities to build comfort and connection with others? And very often you'll hear, no, there's not as much as there could be. We think about comfort precedes communication and progress does not occur in a large group. So responding, as you said, is often easier no matter what the stage is, and initiation is often harder. We'll have individuals that are verbally responsive, but they're not initiative. So of course that's like, that we can go on and on about why, that happens. It could be ability, it could be comfort, it could be lack of social know-how, communication, putting their thoughts together to say them. Others have been answering for them. There's so many reasons why initiation is harder for the majority of individuals. But let's talk about this with these questions. What I think about, Dr. Jenna, is what opportunities have you had to build that comfort and confidence and connection? Have you done outside get-togethers? Have you picked within school 2 to 3 buddies that you are focusing on to pair and group with? Like you said, facilitation, don't wait, facilitate. Are they waiting for these kids to just start to talk when there isn't even opportunities that are contrived and facilitated by the adults to connect? So something as simple as, even if you think about the home environment, are there opportunities to do get-togethers? And during those get-togethers, what are high interest activities
Mm-hmm.
that you can do? Because high interest activities are more of a big shot role, handover, takeover, opportunities through PVC, prepare visuals and choices, using the verbal intermediary. Do you want red or blue? No answer, red or blue, tell me. Like, what opportunities are there that parents themselves, through baking, through art projects? I had an older teen doing a baking project. They had friends over every other week to do baking club at their home. It's like you have to get really creative, Dr. Jenna.
And I would say for those listeners that maybe have a teen or a young adult that they're working with that maybe is in high school or even college, thinking about, it might be less comfortable to have quote unquote a get together in your home environment. And so like what could equivalents of those get-togethers look like? And so as Dr. E mentioned, writing down even like a list of your high interests is so important, because for our older teens that maybe don't feel as comfortable to have a peer over because it feels quote unquote awkward or it doesn't feel
Yeah.
as natural for them, some of those get-togethers can be, engaging in a club at school or a club in college, right? So we have times where we've talked to educators about, hey, so and so loves chess, is there a chess club that we can kind of start to facilitate? And maybe there's a staff facilitator that's willing to start a club like that. And then all of a sudden, your child, along with 3 other kids who have similar interests, are engaging in chess club every single Tuesday, and then those people become their people, and then maybe one of those peers wants to also join a chess club outside of school, and then all of a sudden they're engaging more outside of that environment. So we have to get creative sometimes based on age of the
Oh,
child, based on different opportunities. But
100%,
I,
100%. And it's not just, why aren't you talking? You need to talk. Most of these individuals, whatever age they are, they don't have the connection. And
Mhm.
so we find, quote unquote, our peeps by our areas of interest, especially as children age.
Yes.
So with little kids, you set them up with coloring and puzzles, and the parent or the teacher facilitates. They do, different board games that are fun at their level. Whatever it may be. It could be any activity. It could be letters and sounds, but it's knowing their baseline stage of communication and facilitating the next stage without a doubt. It's not linear. We talk about that with
Yeah.
the social communication bridge. It's not like you master one stage and go to the next and go to the next, but it's being very creative. And sometimes when you talk to a family, they'll go, well, this is a lot of work. And I'll say, it really doesn't need to be, because regardless if your child had SM or not, finding connection is really important to relationships.
Yeah.
And the way we find connection is through areas of interest, especially as children age. So the chess club, that's a really common one. We deal with a lot of older teens and adults in our practice, and I often have given an example that I love. And one example, I give lots of them, but I'll never forget the rock climber.
Mhm.
This was an older individual who loved rock climbing, and he himself, through therapy, we worked through it. He joined a rock climbing center near his home, and we worked on it together in therapy, a list of, if you like rock climbing. He put it in his high school. Meet me, let's get together. And they had like a message board, got together. He found 2 or 3 friends or people that connected with him. I think 6 signed up. It was crazy.
Mhm.
And anyway, 2 or 3 of those kids became his besties.
Mhm.
And then during spring break, listen, I wouldn't have done this. Things, me. I don't know that I would have been encouraging rock climbing. I think I would have been terrified, but that's me. But anyway, it was okay for that family, and he found his besties. The
Mhm.
same with a 6-year-old who mastered chess, super bright boy, loved chess, had these really cute Thomas the Train chess pieces. And during lunch bunch and friendship group, he did chess, and 2 or 3, or maybe, I think it was like actually one particular boy loved it as well. But they had a chess club with 2 or 3 kids. I think it was 2 girls, 2 boys, and they did that. And don't you know, the mom got together with the other mom. They had a get together. The child started coming over. Now, for this particular boy, 6, was starting to read. He felt very comfortable when it was written out, like certain things that he would need to say. And he played chess at first non-verbally, started laughing, goofing off, and all of a sudden that particular child started to spontaneously speak
Mhm.
without any parent facilitation, because of the interest and to get his needs met. Like, no, you didn't do that, or give me that, or whatever. It was amazing.
Yeah.
Became his bestie. We paired and grouped him with that child in school, became an intermediary, and voila, everything started to fall into place. So it all started with comfort and connection.
Yeah. Yeah. It's huge. It's definitely something that we never want to minimize. We had an episode where we released the 3 C's, which is comfort, confidence, and connection. And we definitely recommend listening to that, just because we do talk so much more about those 3 C's and kind of dive deeper, but they're
And
so
communication. Sometimes we interchange, right? It's
well,
um,
those 3 C's lead to communication. So
yeah,
without those 3,
absolutely.
it's hard to
Absolutely.
have that. So
Yeah, so I mean, listeners, how many of you are focusing on, why isn't my child speaking to a peer? And I'm just going to, divert a little bit and say, look, sometimes it's comfort, connection, confidence building through all of that leads to communication via teacher, parent, adult in their life facilitation. But sometimes it's ability. It's
yeah.
not about the comfort. That's, of course, a baseline. But do they have the social ability, the connection ability? Is that something that's really a struggle? I consulted earlier today with a family. The child's about 10 and really struggles with social understanding and know how. It's something they do. They had come to the center, And this was a concern of theirs. And of course, some additional testing is being done. And it's not just about that. It's not just get comfy, cozy, connected. It's really the social puzzle that's really a challenge. And this is why it's hard to treat to speak. And you can't. You have to assess to understand. And through that understanding, you develop treatment.
Yeah.
Home, real world, and school-based accommodations interventions. That's just such a great quote, Dr. Jenna. I really wish we need to pull that one out.
Yeah.
We assess to understand. And by that assessment, we are able to understand. And that is why for us, the selective mutism eval that we do isn't just to see what type of treatment you need, but let's conceptualize your child, your teen, the adult we're working with's presentation.
Yeah.
And so with all of these questions that come in, a repetitive theme that comes up is this child needs to be in treatment, and treatment with a professional that understands that it is way more than not talking. But I'm hoping that our listeners are hearing from this the importance of that social connection and comfort building, and all the different activities that you can do through the gradual. Like, one of the things is through small gatherings. It doesn't even have to be in the home. It could be parents create these opportunities to go to parks, to go to nature centers, to go to the zoo. It doesn't have to be on the home. And as you said, as kids get older, it's harder because they don't have the connection for mommy or daddy or whomever to set these get-togethers up, which is why we rely so much on the school to set these clubs and activities and small groups up. And very often, my recommendation is the school suggest it. As soon as mom or dad or someone suggests it at home, I mean, this is your experience too, especially for older individuals, we find they say no. I don't want to do the club. I don't want to do the activity. And this happened the other day when we were consulting with a school. I suggested to the school, you be the one to say, hey, I'm going to go with you. Like, this was a resource teacher. And they went and did a club or activity together with that particular individual rather than mom or dad suggesting it. And since that individual has the ability to be there with that school professional, they're more likely to do it because it's just part of their day.
Right.
And that is a great way to segue into these clubs and activities, if possible, with someone they know to be a safe person in that situation. Of course, if they know any peers, that would be even better to have that too.
Yeah. Yeah. Definitely.
Do you have any thoughts or questions on that? Like, just like listeners with what we said, please write in. It's really important for us to get your questions. We love them. We use them in these Ask Dr. E and Ask Dr. Jenna segments because these are your questions.
Mm-hmm.
This is what the majority of individuals ask. And it's always, how do I get my child to talk to other peers?
Mm-hmm. Yeah. Yeah.
So as we're talking about, focusing on peers and wanting them to talk to friends, we're going to take that and move it to the side because we're now realizing it's way more than not speaking. It's about forming those connections and the comfort, areas of interest, confidence boosting, lowering anxiety, and implementing the appropriate strategies and interventions to help the kids make that progress through areas of interest, and not focusing on speaking, but maybe it's hand over takeover in the beginning. Maybe it's, sounds to words. Maybe it's using a verbal intermediary, whatever that strategy would be. And I just want to be clear with listeners. It's so hard for us to tell you what strategy to use. There's a listener or two that might say, well, give me the strategies, give them to me. It's based on your child. It's based on your teen. It's based on you. If you're an older individual, it's how do we put these strategies together in a recipe format for you? So it's really hard for us to say, do this strategy. I will tell you that when we talk about comfort, connection, confidence boosting, that's universal.
Mm-hmm.
It lowers anxiety, plain and simple. Don't wait, facilitate. It's universal, but what you're facilitating, how you're doing it, when you're doing it, with who you're doing it, what strategies you're using, when, where, and how is really the unique piece. And that's why for us, SCAP being a whole person approach, a very CBT based approach, being very behavioral, obviously, exposure based, etc. It's so much of meeting that child where they're at, knowing that unique individual. What are their whys that are contributing? Because no one's just born to be selectively mute. There's a reason why they're not communicating. And what are their baseline stages? That's why when we do the selective mutism eval, or the selective mutism interview, we are conceptualizing the case. We are telling you this is how your child, the teen, the adult presents. This is it. This is your case. These are the contributing factors. These are your baseline stages to start at. Here are best strategies that we use during that selective mutism evaluation, for example, that helped with progression. These are the areas of focus and treatment. We're going to help you do 1, 2, 3, 4, and 5, 6, 7, whatever it is. And this is the direction of treatment, and these are our recommendations. That's what it is. And I keep bringing it up because whether you work with us or not, the selective mutism eval conceptualizes your child's presentation, your teen's presentation, the adult's presentation. It conceptualizes it. And that's where we pick which strategies to use and when. Everyone should have a small group. Everyone should have a buddy process. Everyone should, understand that comfort precedes communication. Progress doesn't happen in a group. But it's when and how and where and with who you use these strategies and how you manipulate them to be able to help with progression, to build that more confident social communicator. That's why it's so hard for us to say, do this strategy and when. We can talk about the various strategies, but how it works for your individual with SM is really what makes this work. And I call it a unique recipe. It's a whole person approach. It's a recipe that your child needs, your teen, the adult struggling needs to help them make that progress. And I'm saying this with such passion because so often it's like, give me the strategies. Tell me what the 504 is. Tell me what no, it doesn't work that way. It's about knowing who your child, teen, adult is. It's about understanding that. And so we talk about the transition time, with this podcast is airing towards the end of a school year. It's April. It's April. And it's now winding down. And for many individuals with selective mutism, the end of the year is harder than the beginning of the year. I would say universally, the beginning of a school year is when anxiety is highest for everyone. You're starting in a new grade, a new school year. You're going to have new kids in your class, new teachers, new professors. Everything's new. Your classrooms are different. You might be transitioning into a new school year. So the beginning or transitioning schools, not just a new school year. Of course, you're transitioning to a new school year as the school year ends, but it's going to be maybe a new building, kindergarten to first or preschool to kindergarten, middle school to high school to college, workforce. These transitions are huge. And we're going to go into an episode and we're going to talk about an episode coming up on transitions. It's going to be a meat and potatoes, heavy transitions. But to tell listeners right now that it's a very key time to start thinking about the next school year. You don't want to wait till the summer. You don't want to wait till the start of the school year. You need to think about, does my 504 or IEP for kids under 12, grade 12 need to be adapted? Does testing need to be in place? Are you implementing strategies and your child is stuck? Is learning affected? Are they having difficulty starting, completing tasks? Is it, what else could be going on? Do you need testing? This is when we do it. This is when we start thinking about educating for the new school year, to think about peers, to think about pairing and grouping with as many peers as possible that your child is having outside get-togethers with that have similar interests to. Can we think about that from a school perspective to make sure they have buddies for the new school year? So it is not too early to think about walking the halls of the new building, being upbeat and positive. I have to reinforce that because parents get nervous, they get scared. And I'm going to tell you that how you handle this is how that's projected onto your child. So if it's exciting and it's new and it's going to be great, versus, oh my God, I'm worried, I'm nervous, I'm scared. So that transition part is really, really important. And how we work that transition obviously is unique for your child. But I will say globally, thinking about next year and how we're going to educate that new school year staff, how we're going to help with that new building if we're moving into, how are we going to work over the summer with peers, with building those connections that ideally could be in their class 504s, IEPs. Anything else you want to add? Because I know I just rambled on, but it's really an important topic that I want to spend more time with in another episode.
Yeah, no, I definitely think we'll have more, thorough conversation when we have a longer time to go through everything, but everything you just said I think is really important. And I also would say like definitely rely on your treatment provider, right? Whether that's us or whether you're working with someone more locally, we can definitely help you navigate a lot of these changes. Literally right before this podcast, I was working with a family who has a 3-year-old and already knows that they're transitioning. And so we worked through that today, and it's only April. So having those conversations prior, kind of trying to prepare your child, trying to prepare yourselves, thinking about what, like you mentioned, like what does this summer look like? How can I get them prepared? What's enough preparation versus what's too little preparation? Like there's so many things that are important to note. But again, I think the biggest factor is definitely having these open communications, with us, with your provider to really help you navigate because, you're not alone. And I think that there's many families that feel similar to you. If you're a family that is, hoping to attend, like a future communicamp or you've been to a communicamp, you know that many times we talk about school during our communicamp weekend, and specifically over the summer we talk about school, but a lot of that is that transition period because we know that it's the summer break. And so sometimes those are frequent questions that are asked. So there's definitely ways, whether it's a group setting, whether it's, individually with us. But yeah, it's definitely a very important topic. So we hope that this was helpful today. And we're excited to, yeah, release the next episode of Transitions in the future.
Yeah, no, this is great. And I do just want to say something else about Communicamp. If your child does struggle in school with communication, social engagement, or even academics in terms of like figuring things out, is there something else going on? One of the things that's so wonderful about Communicamp is because the kids are in a room with trained clinicians as quote unquote counselors, we're able to see a lot. We're able to really see how your child navigates. Are we seeing things that are flags to maybe think about other challenges that might be going on? Learning, we even see other social communication difficulties that may need additional testing, but also we can really see what works for them. And what's beautiful is that kids make huge progress at Communicamp and they see themselves in a school environment, an actual school making progress. And that feeds so well into school because they were in a school and they made progress. So with that, and then that, literally 15 plus hours working with parents, coaching them, role plays, we really teach the skills to the parents and we really do help them see this in just a different light. One of the questions I ask at the very beginning of most communicamps is, how do you see selective mutism? What does it mean to you? And it's amazing how people have different definitions, but it's amazing how they view this so differently as the weekend goes on and what they learn about their child, because it's really about working through that so that you have a really strong understanding and conceptualization for your child and what their needs are so that you can really fuel that progress from day one, day two, and ongoing. So we do encourage and we want to tell families, if you are considering Communicamp, please know if finances are a challenge, we are so passionate about helping families. We offer financial assistance based on need. We do have grants often given by other families. We give our own grants to help families attend. So we don't want costs to get in the way. We want to help you as much as possible to attend.
We'll get back to the episode in a second. You're exhausted from advocating, explaining, and hoping someone finally understands. Well, we do. This summer, consider Communicamp for you and your family. Communicamp is the Smart Center's intensive all-day treatment program designed to help children and teens ages 3 and up build social communication confidence. Over the course of one full weekend, your child or teen receives 15 plus hours of expert led skill building, while parents receive 15 plus hours of training and support. Our clinicians use Dr. E's evidence based treatment, SCAT, that's helped thousands of individuals find their voice. Here's what matters. Unlike other programs, your child or teen doesn't need a talk to come to camp. We meet them exactly where they are. We have 3 Communicamp weekends happening this summer: June 26th to 29th, July 16th to 19th, and August 7th to 10th. Visit the link in this episode's show notes to learn more. Stop waiting for your child or teen to grow out of it. Make it happen this summer. All right, let's get back to this episode. This is definitely a very frequent topic. I know that throughout this episode, we're going to be talking about grief with the understanding that you maybe have looked past and recognized maybe you're an older adult that maybe wished you had gone through treatment earlier, or grief as a parent looking at maybe the diagnosis of your child with selective mutism and having to work through that and navigate it. So this client, wrote in this question that says, how do you process the grief of not receiving proper SM treatment as a child, knowing your life could have been different, right? Especially when seeing younger generation success stories. So like, what does that look like for me? And I think that's a really, really important question. That's a question that we get a lot. I would say a lot of our older teens, young adults, and even into our later adulthood population sometimes asks us. And I think it's definitely a great question to like dive deeper into. What I would say is, every individual is different and everyone's journeys look different. And I think that what maybe you worked through as a child might have looked different than someone who worked through maybe some more of their SM treatment as a child. But the idea that you're succeeding and you're finding a lot of this success now and you're working through some of these challenges is such a great thing. And I also think that treatment and success look different for everyone. And so, maybe there were barriers at various times of your life, but the idea that you're so self-aware now and you're finding various ways of success show that you're probably right where you're supposed to be, and it's probably part of your journey. But I do think that we have gotten many individuals that will say, I've seen so many success stories of like a 6-year-old who overcame their SM, and wow, that's so great that they didn't have to work through some of these challenges throughout high school. But again, I think that some of those obstacles make us more resilient, make us stronger, and it's part of our story. And now we can kind of reflect back on that, and see kind of the success that we've overcome, but also recognizing that like we can't really, as much as it's hard to do, we really should try our best not to compare ourselves to other people, because as I keep mentioning, I think that we all have our own journey. I don't know if there's anything, Dr. that you wanted to add, but I think that's definitely a frequent question that we get a lot.
I mean, there was you, as you were saying it, I was writing down some notes, and you basically said what I wanted to say, especially about the resiliency. But I want to reassure listeners, one of the things that I feel sets me apart when I do these podcasts is my 30 plus years of experience working, frankly, with this population over the course of my medical career. Thousands and thousands of individuals. And again, as we talk about, we do a lot of work with teens and adults. One of the only centers that works with teens and adults because they found us and it's one of our specialties. And I want to reassure those individuals that are feeling this way, that having worked with so many, that it does make you stronger. It's part of your journey. And although that may not help you completely, what I want to tell you is that you can overcome this and reach your capacity. How do I know this? Because over the many, 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 many years I just shared, I've seen it happen countlessly. And the most important part is your internal motivation for change. Very often, young kids may not have that internal motivation. Parents do. And as kids age, it either gets stronger or it gets weaker, that motivation for change. And part of that is due to the acceptance, meeting an individual where they're at. Again, can go on and on about that. But I want to reassure those that feel that sense of grief. Guess what? This is the beginning of the next step for you if this is where you're starting. Whether you're 10, whether you're 15, whether you're 20, whether you're 30, whether you're 50. We've worked with individuals that are adults and they have said all the areas of their life that they have struggled with and how sad that is for them when they hear these, success stories. But what I want to tell you is step by step by step, we look at what is important for you. What do you want to do that you cannot do? And we're here for you to help you. And the key is step by step. It's not just diving into the deep end. It's How do we find peer connections? How do I assert myself? How do I become more initiative? How do I become more elaborative? How do I leave this present job, if I have one, for something that I know I can do better? How do I pursue my education in an area of interest when I'm afraid? How do I join that outside club or activity?
Right.
How do I go up to a peer and start a conversation and ask someone for a get together? How do I assert myself with family members? How do I do it? How do I do it? That's what we're here for.
Yeah.
And
Yeah.
so many times we just hold your hand and you just walk with us through this.
Hmm.
We help you.
Yeah.
So finding that treatment provider that can not only treat, but be your coach and really help you. What else are you thinking from that? Because this is a theme, and I'm really glad that we got this question because it's also the grief that comes along with finding out the diagnosis for a child
Yeah.
and how to deal with this. My friends have kids who, don't struggle at all with social interaction and communication. How do I deal with this? My child has a diagnosis.
Yeah.
So we see the grief come about in so many different ways.
Yeah.
So how about let's branch off into that. Talk about that a little bit.
Well, before we get there, I did want to kind of add a little bit more into like the older population. Two things kind of came up when you were talking. I think the first thing is this individual, when I was looking further at their question, was mentioning a lot of, shared that occasionally they would get upset knowing that their life could look different with an early diagnosis, but instead they used, they had years of ineffective play therapy. And then they only began really talking in school in sixth grade when they were forced to. So
I
they
hate that word. You know that, right?
yeah, and this is what the individual said that
No,
they
of course. I
but,
just, oh,
yeah, but I do think that when I hear that and just emphasizing what you mentioned earlier, I think you mentioned this a lot in like various podcasts, but that idea of like quote unquote ineffective play therapy, right? And we get this a lot where we have people come to us and they'll say, I've been in treatment. I just worked with someone actually who is now 20, was in treatment since they were 4, and is still and still struggling a lot, and has said, yeah, we've been in therapy since 4. And I'm like, okay, well, let's talk about that. Like, what have you worked through in therapy, right? And I think that it's so important to find a provider that understands, that really can help you, guide you through. I think you mentioned this a lot, Dr. E, how when we talk to even treatment professionals or school teachers in school, and they'll say like, when can we expect our kid to speak? Is it going to be, let's say they're a second grader, is it going to be by fifth grade? You're like, wait a minute, with the right interventions and with their right capacity, they should be able to overcome and work through a lot of these things this year. Like, we can work through this now. And so I do think that sometimes there is a little bit more of that decreased expectation when maybe people don't feel like we can succeed even further. So finding that person that knows your capacity is really important. But the other thing is, I have a college student that I'm now working with who, really struggled like throughout her whole life. And we kind of talked a lot about that now that she's overcome her selective mutism and is working through her other anxieties. And we talked a lot about how sometimes I notice that she minimizes a lot of her progress. Like, she'll talk about kind of the previous goals that we've worked through, where maybe we set a goal where 5 times a week, she's going into a store and saying thank you to the store clerk, or we're working through various moments of her initiating, can I have an extra fork at a restaurant, right? And again, we do that because real world exposures are practical, they're predictable. So sometimes we focus on that. But now that she has overcome a lot of that, she doesn't really remember it being as much of a struggle. And so she'll minimize, like, oh, well, like, that's not a big deal compared to what other people go through. And I'll say, well, in that moment for you, that was the biggest deal, right? Like, you were really stuck within your own world for a long time. And we shouldn't minimize that. So yes, you've overcome a lot of that. And now you're, becoming a young adult. But, I think I would say to a lot of the listeners that maybe are feeling that grief piece is, there's probably a lot of small successes within that window of time. And to remember that, because I think that sometimes when we reflect back, we tend to think more about those negative feelings. Unfortunately, I feel like negative feelings have a heavier weight than some of the positive feelings, but within there's probably a lot of, trickles of that positive feeling. And I think that's important to kind of reflect on, just to kind of build up more of like your confidence and esteem, because that's also part of your journey too. So I just wanted to highlight that because I think it's important not to minimize, some of the goals that you had set back in those days.
I kept thinking of the word gratitude when you were saying this, that what you're sharing, and this is something I work with parents on when they're negative or sad about their child's progress or lack thereof, especially when we first meet them. Believe it or not, the kids, well, I mean, I have to keep myself on task. You know me, I can go off on tangents upon tangents. But I think to myself that sometimes parents focus on all that their kids aren't doing rather than all that they are doing. And when they feel confident, and we see this over the evolution of intensive treatments or just treatment at center, but also at communicamp over the course of just day, you
Mhm.
see the change in the confidence, in the hope, in the belief, and that projects over to your child or your partner, whomever it might be. So it's really important for those listening to this that if you are working as a parent, if you have a child with selective mutism, if you're a teacher of a parent, sorry, if you're a teacher of a student with SM, you need to project hope and confidence and being pleased rather than, oh, why aren't you doing this? Oh, you need to do it. You should do that. As soon as you get into those conversations, that's when that projects over to the individual with SM and actually not only halts their progress, but
Mhm.
often causes regression and avoidance
Mhm.
because they feel like they're failing. And when you really talk to these individuals, parents specifically, they feel grief, they feel sad, they feel upset, and they're projecting that. So we have to really work hard with parents on, minimize the negative, focus on the positives, minimize the negatives, and all that your child is doing, not what they're not doing. And what are they good at? They're all good at something, right? And really focusing on those areas and be grateful for those. And we have to even get into things like great gratitude journals for not
Mhm.
only the adults that you're talking with, but also for the kids, the parents of the kids struggling. Do you want to
Mhm.
talk a little bit about that? Because we don't talk a lot about it, but it really made me think about that because that helps them not just be grateful, but add in there a section of what did my child do that was positive. Now, if your child or you as an adult struggling haven't been out and about, haven't been doing exposures, haven't been doing strategies and interventions, you're not going to see it.
Yeah.
I mean, think about COVID, right? There were families that just never left the house
Yeah.
because they couldn't. You didn't see the progress.
Yeah.
But for those that are out and about and doing exposures, and more exposures, meeting them where they're at so there's success, not expecting them to do something they can't, you see the progress. We see it every day at our center.
Yeah.
Children, teens, and adults should not continue to be mute. There are strategies and inventions for everyone, no matter what your why is, to adapt to develop that treatment. So, again,
Mhm.
with all that I just said,
Yeah.
touch on this because you, as a psychologist, deal with this so much.
Yeah, I mean, I think it's hard because I think when we think about treatment in general, we're going to treatment typically because we're experiencing a challenge, right? And for our population, challenges to get our words out and succeed, right, from that element. But I think that, you know, we focus a lot on, okay, yes, they're doing this now, but we want to get there, or yeah, I guess they did that, but we want to move forward here. And so yes, we want to focus on that, and that is what your treatment provider is meant to do, right? So when someone comes to me, I do want to hear your successes, but many times I want to hear your obstacles because I want to be the one to help tweak that to make it more successful. So we're not saying we don't want to focus on the things that are challenging, but I think
Right.
in doing that, it is important to reflect on, well, what are they doing? Because I think as you're mentioning, like, if we don't do that, many of our individuals that we work with, when we think about those whys of selective mutism, like 30 to 40% have, underlying speech and language challenges. So their expressive, abilities are tougher. So they might not be able to express their frustrations in some capacity. But we do have like over 80% of our kids that also have sensory sensitivity. So they're just sensitive and perceptive. So they're taking in so much of their environment, right? For those individuals that are overstimulated at times. And so, why I'm saying that is our kids are actually very perceptive to our own emotions and our own feelings more than we think. And so if we show them that we're grateful and that we see their success, that modeling actually, believe it or not, falls onto our child more than we think. So the more that we're seeing and we're emphasizing and we're bringing that out in them, the more that they're likely going to start to see themselves in that way. Because for so many of our kids, they're that quote unquote child that doesn't talk, or that they're that child that is sitting alone in the corner in the classroom because their teacher doesn't know how to get them to engage with the other peers. And so they might be internalizing that and feeling that, and they might not know how to vocalize that, right? Or they might be feeling alone. But that's why there's so many times where we want you as parents to be those people to start bringing them bringing them out, highlight what they're good at, right? Bringing That's why we talk so much about high interest things. Is not just because, yes, we want to bring out other same age peers, right? And kind of similar minded people, but it's also to show your child, like, this is where you succeed. This is where you're your best self, and we want you to become that best self in all other aspects of your life. So we don't want to just focus on the fact that you don't quote unquote talk, right? But rather we want to focus on all the positive things that you do. And just in doing that, that confidence piece goes so far. So I think that there is
Which
so much.
lowers anxiety.
Exactly.
All of this is anxiety lowering.
Right. So the more confidence we feel, right, the more comfort we typically feel, the more connection we start to kind of get ourselves into because we're feeling good about ourselves, the more likely that our anxiety is going to lower and we're going to be progressing with our communication. So, I think it's important. I was just talking to a family about the importance of, being grateful. And we discussed the importance of having a gratitude journal where rather than just focusing on all the things that we want to work through in treatment, we also want to focus on the highlights and the wins that we kind of gather each day. So I have a client right now that has a younger child, and I'm recommending to the parents to just every single morning, write down like 3 wins that you feel, right? And kind of 3 things that you want to work through. And so just, the importance of being grateful. There's so many different types of gratitude journals that, we recommend throughout, but I definitely think that's really important because I think that it just, again, will highlight how much your child's doing. And as I said before, that then models, the type of behaviors that then you might see in your child. So definitely really important. And I think if we even have teenagers or young adults too, like even, emphasizing that they also have their own gratitude journals where they think about those wins and they think about, things that they really feel positive about and that they feel grateful for. So I don't know if you want to add anything, but I definitely
I
think.
think when you see things that are successful, you need to capitalize on that. So if, let's say, it's getting easier for you to do certain things. For example, when I don't know somebody, it's actually easier for me than when I'm with my aunts and uncles. So you want to not that you don't work with aunts and uncles, of course, we may need to bridge down with them, but see the things that are easier for you and build those up even more and and go on tangents off that. So
Mhm.
for example, maybe you're working on going into a store and you are now saying to family members, hey, I'll go pick up your prescription. I'll go pick up your dry cleaning. This is for older individuals, but parents too, like start to take the areas that are very successful and bridge to different things to do, and you will see the confidence rise, the anxiety will get lower, and so forth. So it's always moving. But I love the gratitude journal as we kind of, lump it together, gratitude, but it's the things that I'm grateful for today. Well, I am grateful that my child got up as a parent and didn't have a meltdown before school. That's not something to be, yes, you might be frustrated, like, why did that happen? Why in other mornings was she or he melting down, but this morning she didn't. That's a good day. We started out good. And figuring out maybe what those look, listen, and learns, which will be a whole nother episode of look, listen, and learn. What are our kids telling us without them telling us of what they may be struggling with? So with everything that your kids go through, everything you go through as an older individual, there's always reasons and there's always ways to adapt. And sometimes it's bridging down and not having the high expectation. So one of the things I caution our listeners to is, are you meeting yourself where you are, meaning where you're at as an older individual? But for families, parents working with kids and teens, are your expectations where they should be? Or are they too far up or too far down where you're enabling? So that's important to work through with your treatment provider to know kind of where you're at. And then go back and kind of loop it into the whole grief thing. You start to see that you become way more accepting. When you have a game plan, when you have a treatment plan, when you know what you're working on, I have noticed over the course of my career that the grief goes down because they have somewhere to place it. And I know you're nodding. What do you want to say off that? Because I think this is important.
Yeah, no, I think that again, like sometimes when I think of the word grief, I think of the past, right? We think about the past, right? And that's even what, this person wrote in is just this idea around like I'm reflecting back and sad about maybe certain reflections they had as a child. And I think that the gratitude piece, right? Being grateful, thinking about those wins, right? Thinking about, the successes that maybe we did feel again, like I mentioned that example with my young adult client now that maybe had a lot of these successes as a child, but didn't see them currently as she's overcome her SM as those successes because now she maybe doesn't see those as wins, right? Comparatively to maybe what we're seeing for our younger kids that maybe are sharing their success stories as a 6-year old. But again, as we're kind of talking, everyone has their own journey, right? We all have our ability to overcome to our capacity. And I think that, when thinking about that word grief, I think that we, you know, could maybe try to shift that a little bit into how can we become more reflective and kind of reflect back on our past and think about, sure, I could have wanted this to happen or that to happen, but presently, what can I do to move forward and accept where I'm at right now and accept what I've gone through. And in doing that, you might notice a more positive outlook on life. So I think just all of those things kind of go together. And, our hope is that we provided you with some insight. I tried to give a great example of someone that I'm currently working through that has a very similar experience to what this question was. And, I think again, like having maybe even that treatment provider to work with you and kind of tackle that. I think that's a really big part of treatment and your journey as well is kind of reflecting back on that. And again, we're talking a lot about our selective mutism population, but I think a lot of young adults and later adulthood have very similar challenges when entering into therapy is to kind of work through and talk through certain things that they wanted to have happened or certain things that they hoped for in the past. But what I would try to challenge you on is how can we in the present moment look back, be grateful, think about some of those things, but then now how do we move forward to tomorrow and what does that look like?
And having that hope and belief. That's why it's so important for our listeners to be working with somebody that they have confidence in, that can help direct them, that they're seeing progress with, because once that hope is there and the belief, the grief starts to kind of, in this case, go down. Yes, you can't change the past. What's that saying? Depression's the past, anxiety's the future. So with the grief, sometimes you see the sadness in these individuals and we have to be careful with, especially if you're a parent, we're dealing with the projection to your child. But
Mhm.
I see that hope emerge. And when that hope emerges and that belief emerges, whatever age you are, it really does start to fuel more progress. And you start to let go and you start to become way more accepting. So I think that is very important, and we can't minimize the feelings you have. We're not trying to erase them.
Yeah,
We're not trying to dismiss what you feel that you could have done. What if you did do this? What if you did do that? I wouldn't be here. I'd be doing this. Well, you don't know that, number one. And number two, wherever you are in your journey, you're starting. So maybe you're starting and you're older. That's okay.
right,
Or wait, maybe your child isn't so young.
right.
Maybe your child's older and you've been frustrated. You haven't seen the progress. And
Mhm.
now you may need to look for a new provider. It's really about finding the way and starting and knowing, okay, I'm moving forward,
Right,
not focusing on, because you can't change the past. You
exactly.
can only move forward. Thank you so much, listeners, for allowing us the time to talk about this sensitive subject. And it's very important because there's so many different angles to selective mutism. Yes, there's treatment, but there's also what goes around that whole diagnosis and different things that people feel, people sense, and people experience. And it's so important that we address all aspects as we work with families and individuals struggling. And grief is just one of them. As Dr. Jenna said at the start, it's an adult who says, hey, what if my life was different? How am I going to deal with this diagnosis? I never got the proper treatment. And it could be a parent that isn't seeing the success they'd like to see with their child, or the diagnosis itself. And what does that mean long term for my child? So it is really something to talk about in treatment. We address this a lot in our treatment sessions if it comes up, or something that we may be sensing. And of course, at camp, when these questions often come up. So it's very interesting to see how these questions come up, but also, just to end this, to say that some individuals don't realize they're struggling with the grief, and we may need to point that out to them. We may see a sadness to them or a misunderstanding to them, and we need to help reshape this and focus on those positives in life and say, all right, this is what happened in the past, but we're going to move forward. And as we talked about, that hope, that inspiration, the belief, and seeing the success that you have with a plan, and you're seeing yourself make that progress, the grief starts to go away and you become way more empowered. And I've seen this over my entire career. So thank you, listeners. If any questions you may have related to this or any other topics you'd love us to talk about, or questions that come up, please write smartcenter@selectivemutismcenter.org. Please, in the subject line, say, Ask Dr. E, Ask Dr. Jenna. It'll be forwarded directly to us, and we will get them in an upcoming podcast and or a blog, and we will share with you when that episode or blog is posted. So we will address those questions. Thank you so much, listeners, and have an amazing day. Thank you for listening to Unspoken Words, a Selective Mutism podcast hosted by me, Dr. E, and the Smart Center. This episode and all episodes of Unspoken Words is produced by New Edition Productions. Don't forget to submit any questions you have from today's episode using our Ask Dr. E form on our website. Just head to selectivemutismcenter.org/ask DRE. I'd love to answer your question in a future episode or blog post. Remember, for the best of this episode and every episode of Unspoken Words, please follow the podcast on Instagram and YouTube. We are at Unspoken Words _podcast on Instagram and Unspoken Words by DRE on YouTube. Or join our newsletter for additional SM content. We release new episodes every other Monday at 6 a.m. Eastern Standard Time. We'll see you next time.